Hello, everyone. If you're sitting here listening to this, you're probably familiar with the concept of feeling adrenaline, heart racing, sweaty palms, palpitations, shortness of breath, whatever your symptoms are, at the thought of confronting your fears, exposing yourself to an anxiety trigger. It might be just going outside, depending on how severe it is. It might be a fear of flying. It might be social anxiety, going to a dinner party, going out for dinner itself. So the question is, does exposure therapy work, which is talked about? Because it's a really common thing to experience. We often hear about the importance of exposure therapy. So does it really work? Is it something you should practice when you're trying to naturally overcome those really difficult fears? The answer, which I'll talk about in this video, is it really depends on how you're doing it, why you're doing it, and when you're doing it. So there's no hard and fast rule. The first thing to think about is that it can't be forced. So that's what I'm going to talk about in this video. Does exposure therapy work? And what you can do about it. So the thing is, if we understand that anxiety ultimately is not serious, I talk about this a lot. It's a normal response to the state that you've found yourself in. So effectively what we're doing is our adrenaline, stress hormone cortisol that floods our system with the flight or fight response is tricking us into reacting to this trigger. What if something happens when I go on the plane? What if something happens when I go outside and I leave my safety zone? And so it tricks us into getting worried about things that we don't have to. So if we understand that, principally, we then don't really need to force ourselves to expose us to a trigger in order to recover. Because what we're really trying to do is just cope with ourselves in the moment. So we don't have to then force ourselves to face every single trigger in order to recover. Because the body, the mind, doesn't know whether you're actually on the plane having a moment, an anxious moment, worried, or if you're on the couch at home sitting thinking about hopping on a plane or going traveling, flying overseas, flying interstate. And so when we know that is the case, then we can practice without exposing ourselves to the situation. What some people do in terms of falling into the trap, they think, right, I'm going to force myself to go outside. I'm going to force myself to hop on a plane. And there's nothing wrong with hopping on a plane, going outside. But if we're forcing ourselves to do it, what we're probably doing in terms of our mindset is in the background, we're taking anxiety very seriously. We're taking this whole event very seriously. So I'm going to force myself, I'm going to fight it, I'm going to push through, I'm going to get it done. Now, people can sort of have some success with it. I would argue maybe it doesn't necessarily lead them to true recovery because we can use our willpower to do it, but maybe what we're doing is we're suppressing a bit of the fear. We're forcing it down, which ultimately over time puts more pressure on the nervous system, which is what we're trying not to do. So it's all about how you approach it. For example, if you've got a fear of going outside, there's a practical need to be able to go outside, to go to the shops, to function in everyday life, to go and visit people. So it's something that we want to do because it's important. So if you've got that fear, what we can do is expose ourselves to the fear, but we do it with understanding. We know that all we're really afraid of is adrenaline. We know the stress hormone cortisol running through our systems is going to trick the flight or fight into reacting. So what we can do is we can really slow down. We can go, right, I need to go to the shop, so I'm just going to go loosen the body. I'm going to breathe slow. I'm going to walk out to the gate and just see how I go. If I feel okay, I might gently walk to the shops. I'm not forcing myself to do anything because ultimately, if I really understand anxiety, which is what I talk about in my videos, you know what it is. You know that anxiety and the triggers, whilst difficult in the moment, are ultimately not serious. If we feel they're serious, that's when we get into a bit of trouble. We start to force, push through, and then, of course, that can add tension to tension. It can then make the idea of exposing ourselves to these triggers even harder. If you're at home on the couch and you're just thinking about going outside, or if you're thinking about flying, we can practice with the anticipation. So as soon as the symptoms come up at simply the thought of exposing yourself, you can go, I know what this is. I'm going to breathe slow. I'm going to let the thoughts do what they need to do. Drop the shoulders, let the body go loose. And when you do that with the anticipatory thought about flying, going outside, you're already practicing exposing yourself to it. You're not taking the thought seriously, like, I know what this is. And the more you do that, you practice with the anticipation. The body doesn't know whether you're in the situation or you're just thinking about it. So you're actually practicing with the direct situation itself. So when you do go to walk outside, you're already ahead of the game because you've already started to change your default response. If you do decide that you do want to go on a holiday and go overseas, visit a friend, when you book the flight, you practice with the symptoms, fear of flying then. And every time you are able to gently move forward in spite of how you feel, you're going to be already much better when you actually hop on the plane. When it comes to going outside, you've already practiced because the body is practicing with the exact same symptoms as if you were outside, as if you were flying on a plane. So exposure therapy itself can be unhelpful if we do it without really knowing why. It can start to become a battle and a fight. Whereas if we understand what anxiety is, we understand it's not serious, we can just gently work with the anxious thoughts about a situation and use the same tools to enter the situation as needed. So I used to have fears of flying. And I never actually had to go on the plane, force myself to do it to overcome it. When I started to overcome anxiety more generally, because it's the same mechanism regardless of the trigger, the fear of flying naturally went away because I started to understand fear so well that I realized that it wasn't really the plane I was afraid of. It was just afraid of the physical feelings that come along with any anxiety trigger. So I hope that helps give you a bit of clarification on anxiety and exposure therapy, anxiety triggers and exposure therapy. There's other videos on how to relax through these triggers that I put on YouTube, so I encourage you to watch those to break worry cycles, to float or move your way through anxiety. So use those if you're then ready. Start to think about, well, how you approach these triggers moving forward. I wish you all the very best and hope to see you again very soon. Take care.